So what is pelvic floor physical therapy? Many people look up solutions for bladder problems, back pain, sciatica, pelvic organ prolapse, postpartum related issues, after hysterectomy care, having any kind of issue related to the pelvis. You're going to learn in this video what exactly is pelvic floor physical therapy and why do I need it. So keep watching this video if you want to learn more about how it can help you. So for many women that are dealing with a frustrating issue, maybe they went and saw their doctor, they were diagnosed with something, or else they're just having an uncomfortable feeling or frustrating issue that they think is so common, but it's definitely not normal, like peeing your pants when you cough, sneeze, run, or jump, or having to look for a bathroom anytime you're out in public, having that urgency like you need to go all the time. Or maybe you feel pressure or heaviness down in the pelvic floor area and you can't exercise the way you want to. It gets aggravated and irritated, especially at the end of the day. Or it's scary because you even see something protruding out of the vaginal area. That could be pelvic organ prolapse. Many times women with different diagnoses that are hard to actually figure out what it is, but they're having pain in that genital area or maybe pain during intercourse and they can't be intimate with their partner, or they're having back pain or sciatica, other areas around the hips and the pelvis that are surrounded by muscles. And there is a specialty within physical therapy. It's pelvic floor physical therapy, and we have to go on to special continuing education, special training after being a physical therapist to be able to treat women and address those muscles internally, not as invasive as going to a gynecologist. We don't use a speculum, we use a gloved finger and able to insert into the vaginal area, address those muscles and see how they're able to contract, relax, if there's tender areas. We are gonna help you heal and solve these problems in a more holistic manner. So pelvic floor physical therapy, a lot of women don't know it exists, and many times your doctor won't even tell you about it. But we are definitely here to help women of all ages and help them heal their bodies. And these muscles in your pelvic floor are not always addressed, especially if you go to a general physical therapist. They are not going to treat and assess these until they're trained to do so. So if you find yourself struggling with one of those issues that I stated above, I'm going to explain a little bit about what we do in our assessment and how we would be able to help you. So in our office, you would definitely have a full, thorough evaluation of your whole body, how your hips move, how your back and your core muscles are able to fire and function, how you move, how you squat from the floor, how you bend over. All of that is related to the area around your pelvis and around your lower back. So we're going to look at all of those things first externally. And then, like I mentioned, you will be in a private treatment room. It's kind of like going to the gynecologist, but a lot more relaxed and comfortable. And you will be able to undress from the waist down, use a sheet over your pelvic area, and with an index finger, one gloved finger, we address and assess those muscles externally in this area. And then if you're comfortable to do so, we do an internal assessment to find out how those muscles can contract, relax, and also function when you're breathing and under some pressure and force, because many times when you're coughing or sneezing or you're standing up and walking, any movements against gravity, those muscles need to support the pelvic organs. So we're gonna be able to assess those and see if they're functioning properly. Now, many women have these issues that go on for years and years, and it doesn't matter how long it's been since you've had this issue, but there's a lot of things that we can do and teach you and help guide you. Now, pelvic floor physical therapists will also be able to look at the muscles on the backside here by your tailbone, and then also internally, externally, and the muscles along the front part of that really makes up your core. Your core muscles have so much to do with the pelvic organs because your pelvic floor is supporting the pelvic organs from the bottom here too. So pelvic floor physical therapy can be super helpful for women, like I mentioned, dealing with bladder problems, back pain, hip pain, pelvic pain, sacroiliac pain, having pelvic organ prolapse, any rectal issues, constipation, any changes that you feel like you're not really getting to the root of the problem when you're going to the doctor, many times is misdiagnosed, and it's related to the muscles in that area. Now, if you have had a surgery and it's affected this whole pelvic area and possibly even affected your abdominal area, those symptoms are just a big red flag that something is not functioning properly. So with ongoing treatment, whether we're doing an internal treatment, assessing those muscles, treating them almost like a internal myofascial release, sometimes it's working on, not everyone has to do Kegel exercise and strengthen, but we're working on relaxing them and letting them go as well. Then we may teach you yoga poses. We may teach you strengthening exercises for your hips and your core. Like in my office, we use a lot of Pilates equipment, Pilates-based exercises, and that way we're teaching you how to connect your brain to your body to really support your whole pelvis, your pelvic organs, and get you feeling better. So that's a little bit about what's entailed in pelvic floor physical therapy. Women can find long-lasting relief if they're really getting to the root of the problem, and sometimes they're surprised that it can actually recover in a short amount of time. So sometimes we see women and they've been dealing with an issue for years and they come to a few sessions and they're like, oh my gosh, I can't believe how much better this is. I'm not running to the bathroom all the time. I'm not hurting. There's so many benefits. And really, if you're not addressing that area in having any of those symptoms, then you're really doing your body a disservice. It's not great to go right into a surgery without working with a pelvic floor physical therapist or even taking a medication, using some kind of gadget, if you don't know how the muscles are actually functioning and supporting that area. We tend to hold a lot of subconscious stress in that area, and women that have neck issues, TMJ problems, or anything related to the upper cervical spine, a lot of times they will also have pelvic floor issues. They're both subconscious areas of holding and really creating a lot of tension there, and therefore having pain. So we teach you how to actually release those, because many times you can't do that in a conscious state and be able to learn that you have tension there and you're holding it. So we teach you a lot about your body and help you recover and restore it as well. So that's what pelvic floor physical therapy is all about, especially in our office. It's going to differ a lot depending on where you go, but you want to work with someone that you can do a consultation with first, really learn what their approach is and how they would treat your specific issue, and if they've seen it before. You want to make sure that you're going to someone you feel very comfortable with, because they are going to guide you toward recovery and you want to get a great outcome. You don't want to just see a PT for 10 or 15 minutes and they walk out or send you off with an assistant or an aide. You want to work with someone that's going to guide you through and be able to understand your body and your goals and make sure that you're going to get the outcome you're looking for. So thought this was a great idea to address, because people many times will come to us and they're like, I never even heard of pelvic floor physical therapy. What is it? So I thought I would address this today in this video and different issues that it can help you solve and heal for good. So if you want to learn more about women's health topics, I have lots of videos on this channel related to Pilates exercises, back pain relief, pelvic floor solutions, things that you can do on your own to help your own body heal. Then please subscribe to our channel, Level 4 Women's Health. And thank you so much for watching. We really appreciate you checking out this video, and comment below if you have any questions about pelvic floor physical therapy or if you would like to learn more about how to work with us at Level 4 PT and Pilates, virtually or in person in Encinitas, California. Thanks for watching.